being around the pharmacy from 1966, I'm trying to think. So was your father like really ready to embrace change at every turn, or was he more of the kind of traditionalist? And I feel like we should at least mention his name. I'm not familiar, so
Ed.
Ed, all right. So was Ed the I'm ready to evolve, I'm ready for that new opportunity guy, or was he the just give me my typewriter?
No, he was always looking to evolve. He was one of the first pharmacies in the community to actually computerize. So we computerized in the mid 70s. And
Wow.
I'm embarrassed to say, when I graduated pharmacy school in the mid 80s, my first job with the chain, that pharmacy wasn't computerized.
Wow. That's pretty amazing.
Mid 80s, and they don't have a computer, and I was having to learn how to do everything via a typewriter. That was not fun.
No, I just can't imagine. Just the amount of, billing and administrative work after the fact is just wild.
Yeah, submitting claims. What we went through from submitting claims on diskettes, but at the chain, we were having to fill out claim forms. So it was, and that has evolved so much. Thank goodness. You talk about vaccines and the partnership Pioneer has with STC to transmit that to the state immunization sites. It's just tremendous.
Yeah, a couple partners, STC, SMP, really, but like I said, even now, there's still some state agencies that are not all that, technology forward.
Right. So getting back to your question, yeah, my father did always embrace moving the pharmacy forward. And to the point where I think that was part of my upbringing is, we have patients that have problems. We need to find solutions for them. If it's a difficult to find medication, just don't say, oh, I can't get it. Does a colleague have it? Can you buy it from the hospital? What are the alternatives to make sure that we can take care of that patient?
Yeah, absolutely. So that would definitely make sense to make that leap, from looking for solutions to being the go-to for solutions. Especially the example you gave, the mental health arena, where your big box stores probably aren't going to put in the legwork, and a lot of smaller pharmacies probably may not be that open to new tasks, to what may sound like could be more work, could be is it going to be worth it? So there's definitely a level of entrepreneurialism, a level of risk, but also, like you said, that there has to be that passion that says, yes, I want to do that.
Yeah,
because
and then naivety, fast forward or fast look back in my career, I just, that's what you did. You just figured out a solution. I hope at this day, 30 years later, would I still do that? I hope I would.
Yeah, for sure. So how do you make that work when you bring in something new, like, okay, we're going to start basically doing lab testing before anybody else is doing lab testing. And at that point, was it still just the flagship location?
Yes. Okay. That's our traditional retail site. So the other locations aren't necessarily retail. The one in the outpatient mental health center, it's only for the patient population of that agency. It's a 3,000 patient outpatient facility. So it's busy as it is.
Yeah. So at that point, were you still, the like primary bench pharmacist, or did you have other staff pharmacists at that point?
We always had staff pharmacists. Our as you referred to, the flagship store was a busy pharmacy in the community. So we always had 2 to 3 pharmacists, for the most part, majority of my career, that were staffing that location. So yeah, I would staff 35, 45 hours a week and then try to do everything else on top of it. So yeah. as I aged, that became more and more challenging, and pharmacy became more and more complex.
Thanks for listening to this clip from Beyond the Scripts, presented by the Catalyst Pharmacy Podcast. If you enjoyed this episode, please support our channel by liking, subscribing, and clicking the notification bell so that you'll be notified anytime we post new content. To stay up to date with all of the latest independent pharmacy news and content, follow PioneerRx on your preferred social media platform.